Lisa Birnbach. What do you do when you catch a cold? Do you stay in bed, drink plenty of fluids, eat chicken soup? Do you go to the doctor? Luckily for us, Dr. Jordan Josephson, a top ear, nose, and throat specialist, has paid a house call to help us with these questions. Dr. Josephson, how do you know you're catching a cold?
Well, when you're catching a cold, you just feel run down, sniffly, congested. You just don't feel yourself. You'll have a runny nose, postnasal drip, and maybe a cough. Maybe you'll feel a little tight in your chest, and you may have a fever. Overall, you're just feeling just plain lousy.
Is there any way to avoid catching a cold?
Absolutely. People should eat right. In the cold weather, they should stay warm, bundle up when they go out. They should avoid changes in temperature, which are drastic if they can. And we certainly know that eating right and staying well hydrated are very helpful, and maybe some vitamins, a multivitamin and a vitamin C.
What about hand washing?
Hand washing is extremely important. Hand washing wipes all the germs from your hand, and you're shaking hands, you're touching things during the day, so there's tons of germs on your hands, so hand washing is extremely important.
Once you do have a cold, should you go to bed? Should you be with other people? Should you be taking aspirin around the clock?
Well, most colds are due to viruses, and we don't have any antiviral agents that you treat these colds with, but certainly stay well hydrated, a lot of fluids. The more fluids, the better. Number two, get into bed, warm up, bundle up, and make sure that you get plenty of rest through that cold period. And that's probably the quickest way to get through your cold.
And chicken soup, is it just what grandmothers suggest, or is there some real value to it?
Grandma always knows, and they did studies out in Nebraska, and they showed that chicken soup actually shortens the time of your cold and improves your symptoms.
There's a whole shelf or a whole aisle now at the drugstore dedicated to over-the-counter cold products. What do you like?
Many of them are very, very good. Certainly vitamins are good, vitamin C, multivitamins. Second of all, irrigation or saline sprays are wonderful. They wash out the infection from your nose, the virus, decreasing the amount of virus, shortening the length of your cold, improving your symptoms. Hot water, lemon, and honey and throat lozenges are wonderful to relieve your sore throat. And then they have decongestants. If you're really congested, you may want to take a decongestant. I'm not very for decongestants, except for if you really can't breathe and you can't sleep.
Why don't you like decongestants?
Well, decongestants have been shown to have effects on the heart. They've actually taken decongestants and they've actually had a warning recently. The FDA made a warning that's saying decongestants should not be used in children, younger children. I think decongestants have their risks, and I think in most cases you can do well without a decongestant.
Okay, let's say you are feeling some of those symptoms. How do you know that it's a cold and not a flu?
What you really want to do is you want to know that my cold's lingering for more than 5 to 10 days. Hey, I have more than a cold here. Maybe I have a sinus infection. Maybe it's my allergies. And you want to be able to decipher what's a sinus infection and what's a cold.
And you need a doctor to help discern that, right?
Well, if your symptoms are lasting for more than 5 days, you may want to go see your primary care doctor or an ear, nose, and throat physician.
Do you treat a chest cold differently from a head cold?
The answer is no. Most of them are treated similarly. If it's a cold and a virus in your chest and in your nose, then again, supportive care will treat both of those. If it's a bacterial infection that causes a sinus infection that drips into your lungs, so now you have a nose infection and a lung infection, then antibiotics and similar antibiotics treat both of those problems.
And finally, I noticed you haven't mentioned the use of analgesics.
Certainly non-steroidal anti-inflammatories and aspirin and Tylenol will help, especially if you have a fever. It'll also help if you're achy, and it'll bring down the inflammation and swelling.
Thank you so much, Dr. Josephson.
Thank you.
I'm Lisa Birnbach.